I, Dr. Ram Kumar Srivastav, discuss about the Bell's palsy, which is a very common neurological disorder, and I have to differentiate the Bell's palsy with the other facial palsy due to some of the systemic diseases. We know that the Bell's palsy is a neurological disorder, and this is due to the facial nerve, which is the seventh cranial nerve. It develops from second brachial arch. It has two roots, motor root and the sensory root. The motor root supplies the muscles of the face, scalp, auricle, the buccinator, platysma, stapedius, styloid, and posterior belly of the digastric muscle. The sensory root conveys from the cauda tympani nerve the fibers of the taste for the anterior two-thirds of the tongue, and from the palatine and greater petrosal nerves to the taste fibers from the soft palates. So sensory root mainly involves with the taste of the human being. There are two courses of facial nerve: intraneural course, which is in the brain, and extracranial course, when the nerve comes out from the brain by the styloid mustard foramen to the face, then this is a extracranial course. What are the branches of the facial nerve? These are three branches within the facial canal. This is the greater petrosal nerve, nerve to stapedius, cauda tympani nerve, and when it exits from the styloid foramen, this is the posterior auricular, posterior belly of the digastric, and styloid. The terminal branches of the facial nerves are temporal, zygomatic, buccal, mandibular, and cervical. These are the 5 terminal branches of the facial nerve. You can see in this diagram that the 5 branches of the facial nerves are present. The upper one is the temporal. The next one is the zygomatic branch. The third one is the buccal. The fourth one is the mandibular. And the fifth one is the cervical branch. Now we know about the Bell's palsy. It is one of the most common neurologic disorder of the cranial nerve. Bell's palsy, also termed as idiopathic, that is without any cause, facial paralysis, is the most common cause of unilateral facial paralysis. So if facial paralysis which is unilateral and without any cause, then we can say this is because of the Bell's palsy. It is named after a Scottish surgeon, Charles Bell, who first described the connection of the facial nerve to the condition. Bell's palsy is a type of facial paralysis that results in a temporary inability to control the facial muscles of the affected side of the face. In great majority of the cases, Bell's palsy gradually resolves over time. So within 6 to 9 months, ultimately Bell's palsy decreases and resolves within this time. What are the causes of the Bell's palsy? The cause of Bell's palsy is unknown, but sometimes we can find this is because of some viral infection, and especially the herpes family virus may cause the Bell's palsy. Many believe that this disease is due to a viral infection that results in swelling. Some viruses are thought to establish a persistent infection without symptoms. For example, varicella zoster virus and Epstein-Barr virus, both are of herpes family. The risk factors for Bell palsy include diabetes, a recent respiratory tract infection, and pregnancy. So, if the patient is suffering from diabetes or respiratory tract infection or is having pregnancy, then he is on the risk factor that he can develop or she can develop the Bell's palsy. Diagnosis. The diagnosis can be established in particular patient by unexplained unilateral isolated facial weakness. So, if unexplained unilateral isolated facial paralysis or weakness of the facial muscles is present, then we can say this is the Bell's palsy. The onset is sudden and symptoms typically peak within a few days. The diagnosis is also made to determine whether facial weakness is central or peripheral. So these are the two types of the facial paralysis, but the most common is the peripheral. Peripheral facial palsy involves all the facial muscles ipsilateral. This means on the same side of the facial nerve involvement, whereas the central facial palsy weakness involves lower facial muscles contralateral, means on the other side to the lesion in the brainstem above pons and cerebral hemisphere. Differentiation of the Bell's palsy. We should differentiate the Bell's palsy with the other causes of the facial palsies such as human immunodeficiency virus, that is the HIV infection, diabetes mellitus, Ramsay Hunt syndrome, Lyme disease, Sjogren syndrome, sarcoidosis, parotid nerve tumor, leprosy, polyarthritis. So we have to differentiate with the other causes of the facial palsy so that we can diagnose that this is a case of Bell's palsy. What are the signs and symptoms of the Bell's palsy? Acute onset of unilateral upper and lower facial paralysis over a 48 hours period. The posterior auricular pain. Hyperacusis. This means sensitivity to a range of sounds is decreased in the Bell's palsy. Decreased hearing, taste disturbances, otalgia, that is the pain in the ear, weakness of facial muscles, aching of the ear or mastoid. Other signs and symptoms are tingling and numbness of the cheek or mouth, poor eyelid closure, epiphora, ocular pain, blurred vision, flattening of the forehead and nasolabial fluid on the side affected by the palsy. This is very important, and you can see in the patient that there is a flattening of the forehead and the nasolabial fold. When the patient raises the eyebrows, palsy affected side of the forehead remains flat. So these are the two most common findings in the Bell's palsy. Other signs and symptoms are when you blink, your mouth may twitch. Smiling may cause your eye to close. When you salivate, for example, before eating, tears may flow from one eye. You can see in this photograph there is a flattening of forehead, drooping of the eye, loss of nasolabial fold, and the drooping of corner of the mouth. So these findings you can find in the cases of the Bell's palsy. You can see in this photograph on the right side, the patient is suffering from the Bell's palsy. There is no fold on the forehead, no fold on the nasolabial area, the drooping of the eye and drooping of the corner of the mouth. So this is a typical case of the Bell's palsy, and this is present on the right side. This is the photographs of the celebrities which were suffered from the Bell's palsy. The Salman Khan and Angela Jolie, they suffered from the Bell's palsy. Now they have recovered from this disease. Grades of Bell's palsy. The grading system developed by House and Brackman into the 6 categories. The grade 1 is the normal facial function, grade 2 mild dysfunction, grade 3 moderate dysfunction, grade 4 moderately severe dysfunction, grade 5 severe dysfunction, grade 6 total paralysis. This is important. The treatment of the Bell's palsy is very important because the patient is suffering from the Bell's palsy, is having an awkward situation till the Bell's palsy subsides. The aim of the treatment in the acute phase of Bell's palsy is to speed recovery and to prevent corneal complications. This is important. Corneal complication or corneal ulcerations can form because there is a difficulty in the closure of the eye on the affected side, and this may result into some of the corneal complications. Eye care includes eye patching, lubrication with drops which should be applied frequently during the day, and eye ointment should be used at night. So you have to care of the eye because most of the time there is the dryness of the eye and result into the corneal ulceration. Medical treatment is the corticosteroid along with the antiviral agent, and sometimes you can also give physical therapy. Steroids, most commonly the prednisolone, you have to give in these cases to improve recovery of 6 months. Antiviral agent, this is the acyclovir, which should be given along with the prednisolone. These are the medications which you can give in the cases of the Bell's palsy. The one is the prednisolone. The adult dose is 1 milligram per kg daily, maximum 80 milligram. Antiviral is the acyclovir, adults 400 to 800 milligram 5 times daily with prednisolone, and this should be given for 7 to 14 days. Famciclovir and velaciclovir, these are the other antiviral agents. Early treatment with acyclovir in combination with prednisolone is recommended as possible effective to improve facial functional outcome. So the combination of prednisolone along with the acyclovir is the treatment choice for the Bell's palsy. Physiotherapy helps to maintain muscle tone of the affected facial muscles and stimulate the facial nerve. The other treatment option for the Bell's palsy are the transcutaneous electrical nerve stimulation and acupuncture. Physical therapy involves facial exercises and massage may be an option. The other medicinal treatment or the medicines which you can prescribe in the Bell's palsy, these are the methylcobalamin, vitamins including B12 and B12, zinc, hyperbaric oxygen, mime therapy and botulinum oxide, but these are having the limited effect on the Bell's palsy. Surgery, smile surgery or smile reconstruction is the surgical procedure which restores the smile in patient with facial nerve paralysis. The main surgical technique which you can perform is the decompression surgery, is an option to relieve stress on the facial nerve. But this surgery may result into some of the complication. So generally we have to avoid this surgery and only put the patient on the medicine. So medicinal treatment along with the physiotherapy is the treatment option for the Bell's palsy. The prednisolone along with the acyclovir for 7 to 14 days and the physiotherapy by the massaging of the and stimulation of the facial nerve, we can improve the condition of the patient. Thank you.